If your patient has the cash, you give them the joules. I heard this the other day. This is some indication that a way of remembering stable versus unstable. And in this fancy little way of remembering that, it's indicating that if your patient is unstable, you're going to do synchronized cardioversion. So if your patient has the CASH, that's chest pain associated with cardiac origin, altered mental status or acute altered mental status, acute shortness of breath, and then hypotension with signs and symptoms of hypoperfusion, right? That's a good list. That's a good list to remember instability. But it's not that two-dimensional, especially with cardiology. To say that everybody with chest pain is unstable is ridiculous. To say that everybody who complains of shortness of breath is unstable is ridiculous. So, especially in cardiology, this is going to become really important when you have to answer questions on National Registry. It will literally dictate your treatment plan in a question. And on National Registry, it might be the deciding factor on maybe the next 5 questions. So let's say, for example, you get a question and it says your patient has a dysrhythmia, right? Let's say SVT, for example. And they say, they give you the vital signs, a little bit of patient information. And let's say all the vital signs are good, right? They're all within normal ranges, except the heart rate, obviously, they're in SVT. But let's say then they use the term or the descriptive term of shortness of breath and chest discomfort. And then you get to pick between synchronized cardioversion or the appropriate medication. So, does the terminology shortness of breath and chest discomfort make that person unstable? And the answer is no, they are not unstable. To say that chest pain on all questions makes somebody unstable is wrong. And I promise you, you will get it wrong. Somebody with chest pain, just because they have chest pain, doesn't make them unstable. Somebody who is having a heart attack is unstable. Somebody with chest pain associated with a heart attack is unstable. Absolutely. Somebody short of breath with acute lung disease or an acute lung complaint is unstable, 100%, without a doubt. So if somebody has a dysrhythmia, what actually makes them unstable? And how do you dictate that in a question? For somebody to be unstable due to a dysrhythmia, it has to do with cardiac output, no matter what. So if somebody has a dysrhythmia and the heart is beating so fast that the ejection fraction is down and the cardiac output is down, and now it is affecting their blood pressure. Hypotension associated with a dysrhythmia is unstable. That is number one. The only other one I feel that you will get away with is altered mental status. Altered mental status from a dysrhythmia is because there's not enough blood going to their brain due to cardiac output. The heart is beating too fast, and now you're seeing signs and symptoms of hypoperfusion from the hypotension. That's it. That is literally it. Okay? So when you're answering questions on dysrhythmias and you have to make the decision whether that person is stable or unstable, ask yourself, okay, are these signs and symptoms associated with a lack of cardiac output? And that's it. That is literally the things that you should look for when you have to answer dysrhythmia questions. Okay? Thanks, guys.